Okay. Magandang umaga, magandang tanghali, magandang gabi po sa inyong lahat. Welcome to the 82nd episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Maraming salamat po for being part of our credible online community, and to all those who have just discovered us for the very first time, ngayong araw po ito ay sana po masiyahan po kayo at patuloy po kayong tumangkilik sa ating webinar series. For today, I believe you have already seen yung ating mga posters po, and really our topic, which is very very timely, especially since we are ending the year and there are still a lot of targets, in particular for vaccination, that we need to attain. There are public health measures that we continue to adhere to, public health measures that we espouse and try to promote, even if we have already a relatively high vaccination rate, especially in the national capital region. Pero for today, we will be talking about what are the public health measures na kailangan po natin to combat infectious diseases ngayong in this day and age. We want to be able to know ano po bang pagkakaiba ng iba't ibang mga termino, epidemya, pandemya, ano po ba yung outbreak, ano po ba yung tinatawag nilang herd immunity, population immunity, all of these terminologies, we hope that maliliwanagan po tayo for today's webinar. And if you are looking for the latest science-based and evidence-based information, lalo po sa ating mga distinguished panel of experts, then keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date, and this will be our last Friday lunch date for the year 2021. Very, very special po ang ginawa po namin para sa ating last webinar of the year, because we will be featuring ang aking partner, ang international public health expert po natin, also the Special Envoy of the President for Global Health Initiatives, and that is what we announced and have been seen in the posters in the past few days. So please stay tuned if you want to hear more about what Dr. Susie Pineda Mercado will be talking about. So for today, kasama na rin po ito ng specialness ng ating webinar for today. I get to share hosting duties, one of the many faces behind the scenes of our production team. Very, very hardworking po. And hindi na po siya kaila sa inyo because she has been subbing for Dr. Mercado when Dr. Mercado is unavailable. Please welcome to our webinar for today the Assistant Vice President for Public Affairs and also the Director of the Office of Alumni Relations, Assistant Vice President Maria Angelica Rica Abad. AVP Rica.
Hi. Hello, good afternoon, Dr. Raymond, and welcome to all our participants here in the live broadcast of Zoom webinar, and to all those watching via live streaming on the TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, and the Stop COVID Deaths Facebook page. As Dr. Raymond has mentioned earlier, this is our last webinar for 2021 before we go on a season hiatus over the holidays. Kaya nga, no, Dr. Raymond, we're talking about sa meetings, kailangan talaga bongga ang pasabog natin with our main presenter, no? So we are already, seeing in the chat box, everybody's so excited to hear from Doc Susie, no? So let's go ahead and read those who have typed in their messages here in our Zoom chat box. So some of them, we have Dr. Joseph Tortona of Loma de Gato, Marilao, Bulacan, Dr. Jocoso of PCSO, Maria Severa Fe Catalbas from UP Visayas, Iloilo City, Arnulfo Creencia from 13 Martires City, Cavite, Marisa Garing from Santa Rosa, CHO1 COVID Lab, and Felito Sampilo from Manila Health Department. Marami pang iba ay si Lourdes Ilagan from Barangay 739 Zone 80, District 5 Manila, and so much more, no? Ilocos, Los Baños, Bataan, Albay, even from abroad. We have our viewers leaving messages, no, from California, Saudi Arabia. So please let us know where you're watching us from, no, by typing in the chat box, and we will give you a shout out later on as we move along the program. We would like to hear from you, most especially those who are having the watch parties, no, for the Stop COVID Deaths webinars. Please send your photos to our FB page and we will post them or even share them here in future webinars. And no, Doc Raymond, I know many members of the UP Alumni Association in San Francisco are watching us today as well.
Yes, AVP Rica. So, ngayon po, no, very, very special, in our very special webinar, and this is in line with the season spirit. At alam naman po natin na ang Pasko ay panahon ng pagbibigayan. Meron po tayong maikling mensahe po from the UP Alumni Association in San Francisco and the Dept Foundation International. So, please watch this.
Greetings from San Francisco. I'm Sonia Dellin, Director of the Dept Foundation International and Director and immediate past President of the University of the Philippines Alumni Association of San Francisco. We are thrilled and proud to announce, with the kindness of the UP Alumni Association of San Francisco, the Dept Foundation International, together with fellow alum Yobi Benjamin and the Zymo Research Corporation, this group is donating 227,000 units of COVID-19 saliva collection test kits worth $2.85 million, or about 145 million pesos, to the University of the Philippines. While the world continues its battle to end COVID-19, the scholars ng bayan in the United States carry on its effort to support our kababayans in the Philippines. These COVID-19 test kits will be a great help to the university, especially in the Philippine General Hospital, for its patients, the students, the medical frontliners, and the community. These test kits can also be used to strengthen the university's resumption of the face-to-face classes in the upcoming months. The UP alumni here and around the world are always in support of UP as our national university in providing academic excellence to the young Filipinos, as well as the Philippine General Hospital as a nationally designated national hospital for COVID-19 cases. As UP naming mahal says, malayong lupain aming mang marating, di magbabago ang damdamin. Mabuhay ang UP. Maraming salamat po.
Okay, thank you so much to the UP Alumni Association and the Dept Foundation International for your... I didn't know the amount, the equivalent amount, the AVP Rica, so I was stunned and, and pleasantly surprised with that donation. Over to you.
Yes, as Doc Raymond mentioned, the important talaga tong donation ng UPAA San Francisco with Dept Foundation International, because they're going to help with the testing of our students, our faculty, our staff, at Philippine General Hospital. Okay, so as Doc Raymond has mentioned also, the case numbers have been going down in the last weeks, not only in the Philippines, but in many countries as well. And that's why some restrictions like mobility and masking have been lifted in Europe. And life seems to be slowly going back to a semblance of normalcy. However, we were all stunned by the spread of Omicron, leading many people to wonder if this means another round of lockdowns and overwhelmed health systems. So in this webinar, we will ask the question, will we ever control COVID-19?
Thank you, AVP Rica. And for those who are joining us for the very first time, we usually have a brief video prepared by TVUP. It's what we call the person on the street video. It's what we do to put our discussion into context and essentially set the tone for our panel discussion. The question that we pose to the person on the street is as follows. Sa tingin po ba ninyo ay matatapos itong COVID-19? Kailan kaya matatapos ang COVID-19? Please watch this.
Sa tingin ko ay mabubuhay na lang tayong may pandemyang ganito. Siguro baka taon pa abutin ito. Kaya siguro aralin na lang natin kung paano natin magpatuloy ang ating buhay habang may pandemya.
I think matatapos lang yung pandemic if globally lahat ng countries ay mag-harmonize ng plans and strategies kung paano i-maximize or i-utilize yung mga resources, especially the vaccine.
Pero tingin ko naman matatapos yung COVID pag nabakunahan na yung mga 90% o 80% sa Pilipinas. Nakikiisa naman na yung ibang tao sa pagbabakuna. Pero meron pa rin ilang tao na ayaw magpabakuna.
Ang masasabi ko lang talaga ay lalaban lang kasi may solusyon naman. Once na may maramdaman tayong sintomas, magpatingin na tayo para hindi na natin makalat pa yung virus sa ating kapwa, sa ating komunidad.
Tingin ko matatapos na itong next year kasi kung asikasuhin lang ng maayos yung mga nagbabakuna. Tsaka asikasuhin nila yung mga taong ayaw magpabakuna.
At syempre magpalakas pa rin ang immune system ang bawat isa. Kung kaya makapag-exercise, makapag-vitamins, makakain ng healthy foods, siguro magandang ma-practice natin yun. Talagang magkaroon tayo ng healthy living.
Trabaho lang natin, ipagpatuloy natin kung ano yung ginagawa natin sa araw-araw dahil matatapos din naman yan. At huwag tayong mawala ng pag-asa. Dahil darating din pa naman, matatapos din yan.
Magpabakuna na tayo para nandun na ulit tayo sa normal. Makakalabas tayo, wala tayong face mask, makagala tayo kung saan natin gusto. Tsaka hindi tayo basta-basta masisita kung sakaling wala tayong kumain tayo sa labas.
Matatapos din tong laban natin sa COVID-19 kung sama-sama naman tayo at tulong-tulong tayo na gagawin yung solusyon, yung mga dapat at hindi natin gawin ngayong pandemya.
Thank you, TVUP. It's always good to know what people on the ground are thinking. I think lahat naman tayo pagod na, no? Almost 2 years na to, and we all want the pandemic to end. So I think this webinar will help empower our viewers, most especially our healthcare workers, with the correct information so they can confidently answer the question of their patients, colleagues, friends, family, relatives. If they ask them, kailan ba matatapos tong pandemyang to? Go ahead, Doc Raymond.
Okay. Well, that was really an interesting take by our persons on the street, no. So maraming salamat po to TVUP for preparing that brief video, and I hope that's something that over the holiday break that we could ponder upon and reflect upon, and something that everyone could hope for in terms of a better 2022 in that year ahead. Anyway, our webinar is able to accommodate a maximum of 3,000 participants. I'm seeing 620 plus attendees, at least in the Zoom. We all know na marami po ang nanonood sa Facebook at sa YouTube po natin, where we are being live streamed. So please give us a shout out dun po sa comment section. And please let us know if you are watching na kayo lang po mag-isa or may kasama po kayo, whether it's your family, your co-worker, or your relatives po and friends. We hope that you'd be able to join us sa Zoom po. Makapasok po kayo sa Zoom para po mas makasali po kayo and get the full interactive experience in Zoom. We also like everyone to participate in our fun quiz. Ito na po ang ating, as you know, will be our final fun quiz for the year. Meron po tayo sa Zoom at meron din po tayo sa Mentimeter. So lahat po ng hindi po makakasali sa Zoom ay sana po mag-participate sa ating Mentimeter poll for today. So for today's fun quiz, and ito po ay very targeted for those who are not in the Zoom. Open your browser, type in www.menti.com and use the code 70489589. That's 70489589 for you to be able to participate in our fun quiz. And for all those who are asking whether sa ating Facebook Messenger, nagdi-direct message, nag-email, etc., certificates of attendance will be given to those who have watched at least 50% of the webinar duration. Alam po namin na marami po ang nag-attend outside of the Zoom. Mag-message lang po kayo because we have already distributed all the certificates for the previous 81 webinars po natin. So we hope na kung sino man po ang hindi nakatanggap and should have received one, there are staff from the webinar series team who will be taking care po of all of your certificate needs. EVP Rica?
Yes, wow, Pasko na, no? We're all looking forward to sana, no? Very peaceful Christmas. And we always try to bring you innovative ways of learning the correct information and also to give you hope, some hope about our situation. So please join us for this very important session as we will learn the latest information here in your credible online community. We always bring you a distinguished panel of experts for a meaningful discussion on current COVID-19 issues.
Okay, so for those who are again joining us for the first time, meron po tayong standard structure for our webinar using the standard panel discussion format. That we have a main speaker whom you already know who will be presenting about the topic at hand. Then we'll be hearing a set of reactions from other speakers that will be followed by a Q&A session. Those who will be, let's say, prompted to open your videos and audios dahil po meron po kayong katanungan, sana po ay makapag-join po kayo and you will be able to ask any of our speakers live sa ating Q&A session mamaya. All questions coming in from Zoom, from Facebook, from YouTube will be entertained in the Q&A session. Okay, so to set the tone for today's webinar, we are very pleased to have as our opening remarks speaker the Dean of the College of Public Health and also he's the director po of the TVUP, which is also the College of Public Health at the University of the Philippines, Manila. None other than Dr. Vicente Belizario Jr. or Dean June Belizario.
Dr. Susan Pineda Mercado, Secretary Enrique Ona, Dr. Annette David, Dr. Vivien Fadrilan-Camacho, university officials, our friends from TVUP, faculty, staff, students, ladies and gentlemen. A very warm welcome to Stop COVID Deaths webinar number 82, where we will discuss a special topic, this time on public health aspects of the pandemic, control of COVID-19. Will we ever be able to control COVID-19? Just when we thought we would be on a positive trajectory with less transmission and lower hospitalization rates, the identification of Omicron as a new variant of concern has sent new waves of uncertainty and frustration throughout the world. A question in so many people's minds: will we ever be able to control COVID-19? What can we learn from previous epidemics and pandemics that can help us build reasonable scenarios around what to expect? What are the public health measures needed to continue to combat COVID-19 and other major infectious diseases in this day and age? Who will need to take on major roles in leading, overseeing, and implementing these public health measures? In this episode of Stop COVID Deaths, public health expert Dr. Susie Pineda Mercado, a contemporary in pre-medicine and medicine days, hi Susie, will reflect on what it will take to control COVID-19 using the lens of history and the perspective of public health. That entails looking beyond the biomedical solutions to health problems, but rather understanding the ecological and social contexts, political systems, culture, and economics that drive infections and inequalities in health. Reactors will be very familiar figures in public health. First, Dr. Annette David, another contemporary in med school. Hi, Annette. I will not say how many years ago. Annette is a public health expert and active leader in the medical community of Guam. We were together recently in a WHO Western Pacific Regional Office Forum. We will hear from our former professor in surgery in the College of Medicine, former Secretary of Health, Dr. Enrique T. Hi, sir. And last but certainly not the least, a colleague in the Dean's Management Team in the UP College of Public Health, TVUP Philippines, Dr. Vivien, we call her Bing, Fe Fadrilan-Camacho, Associate Dean for Research. The UP CPH, TVUP Philippines, is very pleased to be part of this last episode of Stop COVID Death series for 2021. We look forward to next year's episodes of Stop COVID Deaths, hopefully more public health related topics that remain so relevant to our fellow Filipinos pre, during, and beyond the COVID-19 pandemic. As we are in the Christmas season, allow me to wish one and all isang kumukuti-kutitap, mapayapa, at mapagpalang Pasko po sa ating lahat kasama ang ating mga mahal sa buhay. Stay safe, stay healthy, stay connected. Together, we can stop COVID deaths.
Okay, thank you very much, Dean June Belizario of the UP College of Public Health, for your very inspiring words. Our webinar's title nga naman, Dr. Raymond, is Stop COVID Deaths. And that is our goal by disseminating the latest information for clinical management and treatment, as well as to combat the proliferation of fake news. Kasi nga, during times of uncertainty, dyan talaga lumalaganap yung mga incorrect information na umiikot. No, Dr. Raymond?
Yes, the AVP Rica. So thank you so much to Dean Belizario for taking the time out to give us that video message. And it's not every day that we are able to get a very, very busy Dean to Dean June. So hopefully we'd be able to get him live next time in our webinars for 2022. Before we proceed, we'd like to ask everyone to participate sa ating fan quiz. So ito na po ang ating There We Go. Sa Zoom, lumabas na po siya. Sana po sa Menti, okay yan, lumabas na rin po siya. Meron po tayong dalawang katanungan for our fun quiz for today. The first question reads, which of the following diseases have been eradicated in the world? So isa lang po ang pipiliin po natin dito. I'm seeing a whole lot of attendees medyo papasok na po sa pag-participate dito po sa Zoom at sa Menti. May malapit na po mag 90 sa Menti at meron na po 140 plus sa Zoom. The choices are smallpox, option 2 polio, option 3 tuberculosis, option 4 measles, and option 5 dengue. So bago po tayo mag question number 2, we'd like to greet those who are joining us from Midsayap, from the Senate of the Philippines also, which is in Pasay. Meron din po tayong joining us from the Bicol region. Those also coming in from the House of Representatives in Quezon City. The Dr. Andres Luciano District Hospital in Magalang, Pampanga. From the DOH Malinao Treatment and Rehabilitation Center in Albay. Senior Citizens Association in Barangay Tisa in Cebu City. And Negros Oriental Provincial Hospital in Dumaguete City. Finally, we have those from General Santos Doctors Medical School Foundation in General Santos City in South Cotabato. For question number 2, we have this question. Which of the following infections contributed to the highest mortality across all ages sa taon po ng 2020? Ang mga choices po natin are COVID-19, option 2, tuberculosis, option 3, HIV, option 4, pneumonia, and option 5, diarrheal disease. Meron pong tumatalon po doon sa ating Menti. Pumunta siya sa COVID-19. Okay na okay po yun. Those who are joining us from Zamboanga City Medical Center and Technological University of Philippines, maraming salamat po. There are also those who are joining us from Bangkok, Thailand, Jakarta, Indonesia, Taipei, Taiwan, Doha, Qatar, from Dubai, United Arab Emirates, from Hail, Saudi Arabia, Lunichi Ali University of Blida 2 in Algeria, the University of Fiji, Lautoka, Sacramento, California, St. Catharines in Ontario, Canada, and the School of Healthcare Practice, University of Bedfordshire, Luton, England. I think that's the very first time that I'm giving a shout out in Luton, England. So maraming salamat po. Humabol po ang ating participant from Apalit Doctors Hospital and the University of Perpetual Help Molino in Cavite. So maraming salamat po. We will not be closing our fun quiz dahil alam po namin meron po mga magpa-participate po kagaya po ng ating attendee from Hospital ng Binyan, Laguna. So hopefully marami pa po ang sumali sa ating fun quiz for today. Kasi 63% pa lang po. Sana po mas marami pa po ang mag-participate of our attendees, at least in Zoom, have participated in our fun quiz. Over to you, AVP Rica.
Okay, so I think, the answers of our viewers sa Zoom poll and Mentimeter gives us a good sense of what our viewers are thinking now, Doc Raymond. So let's go ahead and introduce our experts panel. It is with great pleasure that I will be introducing our main presenter. She's an internationally renowned public health expert and was formerly the strategic advisor for COVID-19 in the Philippines. She has served as the director of non-communicable disease and health with the World Health Organization and has served as undersecretary and chief of staff of the Department of Health in the Philippines. Please welcome an adjunct faculty with the UP National Telehealth and one of the pillars in our Stop COVID Deaths family, our friend, our idol, Dr. Susan Pineda Mercado. Doc Susie?
Hello, hi Rika. And teka, parang magulo yan. Okay. So hello Rika and hi everyone. It's a little different to be on the other side of the what should I say? The other side of the panel and presenting. And I just wanted to greet everyone Merry Christmas in advance. Nice to see everyone here. And we're all gonna miss each other during the break, but we all have to take a pause. So I'll go ahead with my presentation, Rika.
Yes, go ahead. Everyone's so excited to hear from you, Doc Susie.
Oh my goodness, the pressure is on. Okay. Okay, so, all right. Okay, so I've been given the difficult topic of will we ever control COVID-19? And I have to admit, I had to think very deeply about what I was going to say because I don't have a crystal ball. No one does. I think as we gain more information, we learn more, we can look at certain trends and sort of see what might happen. So let me start by just talking about disclosure. So I have no interaction or research with any commercial entity involved in products or services for COVID-19. Okay, so I've summarized my work into a couple of messages. So the first message is that the key to control of an infectious outbreak is for everyone to understand the mode of transmission. And when we say understand the mode of transmission, it means that we just don't know it in our head, but we also behave in ways that will prevent us from getting infected. So how do infections spread? There are just a few ways that any infection will spread. One would be through direct contact, such as touching the bodily fluids, for example, of an infected dead animal. Those of you who saw the movie Contagion, that was how that outbreak was described. A chef touched a pig that had just been slaughtered that had a virus, and the chef had the virus and that mutated, okay? Another way would be droplet spread, and we have heard a lot about this for COVID-19, inhaling from another human being's expulsive, let's say, cough or laughter or sneezing. And for the most part, we had worked on the assumption that the spread is mainly through droplets. Recently, however, there's been increasing concern about it being airborne and aerosolized microbes are inhaled. We knew this in the hospitals, but lately with the Delta variant, there's increasing evidence to show that maybe we do have airborne spread in enclosed spaces. We're all being advised not to be in poorly ventilated and congested areas. Fomites, which is getting it from surfaces, such as touching things, and I think nowadays, we know that this is less the means of transmission. In the early days, we thought, yes, might be because of touching different surfaces, but it seems that it's more about droplets and about airborne transmission. And then, of course, there are vectors, mosquitoes, ticks, fleas, flies, and of course, food and water are other ways of getting infections. Now, I was looking for a good example for us to look at how this plays out in history, how understanding the mode of transmission is very important, because if we don't understand the mode of transmission, then we will not be able to prevent it. So one of the biggest causes of an infection that caused many deaths was in 1347 to 1351, called the Black Death or bubonic plague. This was believed to have originated in China and moved through trade of Genoese ships to Sicily, North Africa, Italy, Spain, France, Hungary, Switzerland, Germany, etc. And as you can see, the pathology is that they had these bubbles or parang parang pus that was collected all over the body, and they thought that this was a punishment from God. So you can see somebody praying here, or that it was caused by bad air, or by poisoned wells, or even by foreigners. So at that point in time, they didn't know what the cause of bubonic plague was. Now, fast forward to 2012, bubonic plague reappeared and has consistently reappeared throughout history, but it did reappear in Madagascar in 2012. And this is what the hand of a person with bubonic plague looks like. There were 60 deaths in 2012. Now, what we know about this disease is that this is not because of bad air or foreigners or poisoned wells, but that certain fleas that were found in rats carry the plague bacteria. So it's a bacterial infection, it's not a virus, that bites human beings and then creates those bubbles. Ito yung mga parang mga pigsang malalaki that affect the lymph glands. And in Madagascar in 2017, there were 209 deaths. So this can be treated through antibiotics when it's diagnosed, but you could see that you have a significant number of deaths for a disease that we clearly understand the mode of transmission. Okay, so what they started to do then was, there were many slums in Madagascar. They started disinfecting the slums, but there was too little, too late, and more than 200 people died. The carrier is a rat that carries this bacteria, Yersinia pestis, but the rat doesn't get sick. So the rat carries the flea, and the flea has the bacteria, and the rats are all okay. They're happy, they move around, but it can kill people, okay? So this is just, so instead of thinking about the bad air or foreigners or whatever, actually the carrier of the Black Plague were rats that were on ships. And the rats had fleas and they bit people. And that was the reason why there was a big epidemic. Okay, so let's go to viruses. And you've heard about many viruses, and our discussion will not be about bacteria, but I wanted to talk about the bubonic plague because I wanted to say that we have to understand the mode of transmission. And once we understand the mode of transmission, it becomes easier to control an infection. But sometimes we don't want to accept what the mode of transmission is. We have other ideas about how we get the virus. And with viruses, so these different viruses, corona, rota, influenza, etc., very important to know how we get them. So I'm going to do a little quiz, if this is okay, Raymond and Rika. And because I can't see the chat box, but I'm going to ask the question and please answer in the chat box. How many viruses do you think there are in the world? No open, no Googling. Sige nga, lagay nyo nga. How many viruses do you think are in the world? Are there in the world?
So ang
Sige,
mga sagot, ang mga sagot, partner, ay in the billions, in the thousands. May sumagot ng 6, may sumagot ng 500, 100, trillions. May sumagot din ng infinity and 200,000. So
Okay.
Iba-iba po.
Okay, so viruses are very much a part of our world. And when I tried to look at this, National Geographic in 2020 said that there are 10 nonillion. I don't know if you've ever heard of nonillion. It's not even billion or whatever. Nonillion, or 10 to the 31st power is the number of viruses in the world. And it's enough to assign one virus to every star in the universe, and daming stars, di ba? Times 100 million times. Now, of all those viruses, only 219 are known to infect humans. The problem is, if a new virus starts infecting humans and our body doesn't know how to recognize it, it can kill us. So, despite the 10 nonillion viruses in the world, it only takes one new virus that the human body does not recognize to cause as much disaster as has been caused by SARS-CoV-2. Okay, message number 2. As long as there is a desire for animal meat, mutations of viruses from wild animals will continue to mutate and infect humans. So this was a statement made by Gordon Galea, the WHO representative to China. And this is just going back a little bit to the history of where SARS-CoV-2 came from. Now, what's happening is we're destroying our environment. We destroy our environment, we destroy our forests, and therefore, the animals and the insects come closer to human beings because a lot of those nonillion viruses actually are in the wild, and they are part of the lives of wild animals or wild insects. And if we destroy the habitat of in the wild, then they come closer to human beings. And where you have close interaction between human beings and animals from the wild. So for example, chickens, no? Yung mga chickens, domesticated sila, but sometimes they interact with wild ducks or flying birds that carry viruses that can mutate and affect human beings. So when we take a look at recent outbreaks, okay, so the first one was SARS in 2003-2004, came from the civet cat. Now, the civet cat is very cute, as you can see, but this is a delicacy soup. It's used for soup. And if you butcher a civet cat that has a coronavirus and you have a human coronavirus, the possibility that these two viruses will meet and decide to level up and become an infection for human beings is a possibility. So in the SARS epidemic, the coronavirus of a civet cat, and by the way, many mammals have coronavirus, no? Dogs, cats, civet cats, camels, pigs, you name it, no? They all have coronaviruses, but the coronavirus of a civet cat is only for civet cat. In the same way that the coronavirus for a camel is only a coronavirus for a camel, but the coronavirus of a camel and the coronavirus of a human being can decide to, to live together and make a new kind of virus, a mutation. So dealing with wild animals and eating wild animals actually increases the risk for new viruses to come out. So SARS epidemic 2003-2004 affected 37 countries, 8,000 people sick, 744 died. Now, in 2012-2015, another coronavirus emerged from the Middle East. So this is the Middle East respiratory syndrome coronavirus, and 27 countries were affected, 2,000 sick, and 720 died. Now, SARS-CoV-2, as we know it, right, is most likely a mutation from a coronavirus of a bat and coronavirus of a human being. And so far, well, the jury is not out on this yet, but this seems to be the closest connection. And 219 countries have been affected. 266 million people have gotten sick, and 5.2 million people have died. And this, again, comes from consuming animals from the wild. Now, to understand an epidemic, we have to go to some basic public health principles. And I would like to introduce, and I did talk about this last week, the concept of the epidemiologic triad. Okay, so this is a triangle. And for an outbreak to occur, you have to have an agent. So like a virus, you have to have a host, which could be a human being. And the host and the agent are interacting inside an environment. Now, our agent is SARS-CoV-2, right? There's alpha, beta, lambda, delta, mu, omicron. So mutating, we have a mutating agent. Now, in the Philippine context, we have the host, and the host could be poorly nourished, could have comorbidities like diabetes or hypertension, or a weak immune system. And the environment is where the Philippines has a double whammy, because we have crowded living conditions, many OFWs who had to return from places where the pandemic was, and congestion in the cities. So even if you do everything you need to do about this, but you still have this kind of an environment and you have poor immune systems of the host, it's very difficult to control an infection or an outbreak. So what do we need to do, right? So for the agent, vaccine, of course, is the most important one. And if we had to choose between modifying the environment and doing something about the host, the easiest thing to do is to vaccinate. And we have shown, I'll talk about 2 examples later, how vaccination is probably one of the biggest breakthrough of public health, that we've been able to stop some diseases in their tracks through vaccination programs. Now, under the host, there are many things we have to do, right? The host has to has to have availability of tests, of treatment. The host needs food. So when you lock down and there's no food, then you create what should I say? You create more risk because people's immune systems go down when they're not eating properly, right? If tests are not available, there's no way for them to know if they have the virus or not. And even if treatment is available in the hospitals, if they have no access because they have no money for transportation, how are they going to get treatment? Now, in the environment, how are you going to do isolation if you have 10 or 15 people living in an intergenerational house? And that's typically what we see in the Philippines. In the Philippines, 1 out of 6 individuals lives in a slum area. Safe transport, how would you have safe transport? We don't have, we're not a nation of cars where everyone has their own car. People have to ride public transportation, which may be poorly ventilated. Workspaces may also not be the workspaces may also not be good, like factory conditions, no, where you have very poor ventilation. And then the cities are so congested. You just go to the drugstore, siksi ka na, no? Wherever you are in an urban area of the Philippines. So if we don't address some of what we call these social determinants of health, no? You can vaccinate, but if people go back to this and people don't have what they need to be healthy, then your infection can continue. Okay, so we have to think about, in public health, we think about those 3 things. We cannot be sort of single-minded and just have tunnel vision in terms of how to control a disease. We have to think of all these. Now, let's talk about stages in the control of infections, because I was very disturbed when people said, we're going to eradicate COVID-19. Really? I'm like, are you serious? Okay. So when we talk about control of infections, there are certain stages, okay? And so from pandemic, which is the worst, and I'll talk about what the definition of pandemic is, which is more global, then you have epidemics, which is more local, and then you have endemic status where you always have the disease there, and then control where you're beginning to see a decrease in the number, and elimination where you purposely do extraordinary efforts to get rid of an infection, and eradication where you actually remove the agent. So we said agent, host, environment, you actually remove the agent, right? So for a pandemic, you need to have 3 continents with community transmission, and that's why we have a pandemic. Or actually, all continents have community transmission. In an epidemic, you have a steep increase in numbers in a locality. But if, for example, a disease does not have, you have no cases. So for example, in a particular city, measles is 0 and has been 0 for 3 years. If you have 1 case, it's an epidemic, because it is a steep increase in an infection that you never had for 3 years, all right? Endemic means it's always present in a locality, and there are a number of diseases that are endemic to the Philippines. I'll talk about this shortly. It includes tuberculosis, it includes dengue, it includes a number of, pneumonias. Pneumonia is endemic for our country, and hold it. Okay, and then control occurs when you have a program in place, all right? A program in place that reduces the number in a certain locality. So the program is important because it means you're going to continue to do it over a period of time. You're not just responding like it's an emergency, but you're doing it over a period of time. And then in elimination, you have extraordinary measures that are done. So for example, in some cases, we have, you give mass treatment, let's say for schistosomiasis, you treat the whole community so that you are slowly removing the agent from the environment. And in eradication, the agent is removed globally. So this is usually accomplished through global vaccination programs. Okay, so one of the things I wanted to talk about was that the word herd immunity has been used very loosely during this pandemic. Actually, herd immunity only occurs after decades of routine vaccination, meaning you have to have a program in place to continuously vaccinate people, because people move around, because new people are born, new babies are born. There's a lot of migration, there's a lot of interaction, there's a lot of travel. So routine vaccination is very important. As long as there is community transmission, reinfection is always possible. So herd immunity cannot be bandied around as a target that we're going to achieve in the near future. It takes a long time to achieve herd immunity, unless, so I put an asterisk there, a vaccine is developed for lifelong immunity. So you get one shot and you never get COVID-19 again. We don't have that shot yet. In fact, we don't even know what the level of neutralizing antibodies is for the vaccine. We don't know if your current vaccines will last 6 months or 8 months or 12 months. So science will have to catch up and most likely come up with a vaccine that can be given to children so that they get that shot once and they're protected for the rest of their life. But we are not there yet. So I think herd immunity, okay, that will require a lot more work than we think. Okay, so smallpox was the first infectious disease to be eradicated globally by the World Health Organization in 1980. And this campaign lasted from 1958 to 1977. So I don't know how many years that is. 58, I don't know. Raymond, ano ilan ba yan? 1958 to 1977. Mahaba, no? So this campaign lasted for a long
19.
period of time. Huh?
19,
How many? Huh?
19, 20 years.
20 years, okay, to eradicate smallpox. And buti na lang, it was eradicated because you can see, you know, the suffering from smallpox. Now, polio, first epidemic was in 1894. And the World Health Organization campaign started in 1988. Now, when I talk about the World Health Organization, we're not talking about that office there in Geneva. The World Health Organization is made up of member states. So the different countries, think about it like a club. There's a club and it's called the World Health Organization. And all the ministers or departments of health are members of that club. So when I say the World Health Organization campaign, it means all of the ministries of health or departments of health all over the world started this campaign in 1988. And by 2000, there was a 99% reduction in cases. And the Philippines was part of the success story of polio. In fact, in the year 2000, we did eradicate polio in the Philippines. From 2000 onwards, this ended in all continents eradicating polio, except Asia, where both Afghanistan and Pakistan still have cases. So polio is not globally eradicated because Afghanistan and Pakistan still have wild polio virus, still have children developing polio. And in 2020, there were 140 cases. But as you can see, right, when we're getting to the point of eradication, we are actually counting and reporting the numbers of people who have the infection. And 140 is not a lot of cases for the whole world, but it still means that you have 140 kids out there who got it because of some kind of transmission. So it's not completely eradicated. All right, so what are our tools for managing infections? The most important one is, of course, information. And information is important for changing our behavior, for surveillance or understanding what's happening in a population, for treatment. And so here at Stop COVID Deaths, we talk about treatment and the changes in treatment, environmental modification. So we did, you know, over the past few months, many months, we have talked about the importance of well-ventilated environments, no? And then prevention, which includes vaccination. Now, just a quick look at some of the endemic diseases in the Philippines. Rabies, we have 100,000 infections per year, about 200 to 300 deaths per year. But in the world, we're one of the top 10 that has not been able to control rabies. Tuberculosis, we have 1.1 million active disease cases and a high multi-drug resistant TB rate. Despite the fact that we have vaccination, we have medications, we have what we need, to control tuberculosis, but we have not controlled it. We have 74 deaths per day, and we have the highest TB rate in Asia, or the third highest rate in the whole world. For dengue, we have about 80 to 90,000 infections every year. There were less this year, 324 deaths per year, but the highest risk is the ASEAN. And as you know, this is vector-borne, right? And then for COVID, we have had 2.6 million cases over the past 2 years with 39,000 deaths. I think this must have changed already from the last time I made this slide, for 24 months, or about 53 deaths per day. And second in the ASEAN by rate cases per million. So if you compare the number of deaths from tuberculosis and COVID, of course, it's not fair to make that comparison. We wonder, right, how is it that we have allowed these infections to continue in our country at the rate that they do? And tuberculosis is airborne, mind you. The tuberculosis bacilli can live in the air for 8 hours. So if you are in a crowded movie house and somebody with active TB and multi-drug resistant TB starts coughing, you come in 2 shows later and that bacilli is still there in the air, no? So how is it that we have the means, the instruments, the tools to control these diseases, but we don't do it? All right, so we can ask the question, right? If more people are dying from TB than COVID-19, then why do we respond this way? Well, COVID can kill quickly. So unlike TB, where it takes months or years of suffering before death, COVID-19 seems to pose more danger because it can be short and very intense and requires ICU, critical care, etc. Rich people don't die of TB. Well, there are some people who have money who do get tuberculosis, but the great majority of people with tuberculosis are poor. And they are often blamed for getting tuberculosis. Hindi kasi nila iniinom ang gamot, matigas ang mga ulo, yan ang mga sinasabi natin, di ba? Nobody notices when a lot of poor people die. But when rich people start dying of something, aba, iba na yan, di ba? Kabadong-kabado na tayo. So this is a situation that's really not acceptable because we do have all the means that we need to be able to control tuberculosis, and if we have not done it, and it's endemic. In the early days, we did not know much about COVID-19, and we didn't have good drugs and medicines, and health workers got infected. And so this is a reason why there was such a big outrage around COVID-19, because there was a fear that the health system can collapse, and it still can, right? If we are not able to handle this properly, it can still happen. All right, message 4. Risk communication is one of the most important control measures of a pandemic. And when we understand the mode of transmission, prevention is possible, risk communication is the key. But when people don't trust the government or they don't trust the authorities, we have what is called a destabilized communication environment that causes decision makers to panic and results in unnecessary disease or death. So Peter Sandman, who is the guru of risk communication, says that the perception of risk comes because of our outrage or our reaction and the actual threat. So in the case, for example, of tuberculosis, you have a big threat, right? But people are not outraged, they don't really care. And therefore, we don't think that there's a big risk, but actually there is a big risk. Okay, in the case of COVID, I would say maybe we could say you have big threat and big outrage, big threat, big outrage, and therefore big risk, perceived to be a big risk. And then in another condition, for example, you could have a small threat, right? But a large outrage, people are, very, very scared of something. And therefore, a big perception of risk or malaking takot. So all of this depends on how we perceive the threat and what our emotional reaction to it is. Now, let me just share a 1-minute video from Europe a few days ago.
This was yesterday, Vienna's famous Christmas market, rammed with people cramming in some last-minute festive shopping before the country was once again plunged into lockdown. And indeed, this was the same market today. Austria is facing soaring COVID cases, increasing deaths, and some intensive care units reaching capacity. But it has sparked outrage. On Saturday, protesters making their feelings known, not just about lockdown, but about the mandatory vaccinations plan for February. Organised by the far-right Freedom Party, the placards read, "Coronavirus dictatorship, unvaccinated equals 100% safe." Austria has one of the lowest vaccination rates in Europe. Just 66% have had both jabs. Across Europe, the Delta variant is spreading fast, and so too are the protests. In Brussels last night, police used water cannon against some protesters. They in turn reportedly used smoke bombs and fireworks. The Belgian government has introduced mandatory mask wearing and working from home. In the Netherlands, a 3-week partial lockdown led to 3 days of protests. 5 police officers were injured in Rotterdam on Saturday. This morning, the Dutch Prime Minister, Mark Rutte, described it as pure violence by idiots. While the German health minister said this.
Wahrscheinlich wird am Ende dieses Winters so ziemlich jeder in Deutschland, das wurde ja manchmal schon etwas zynisch genannt, geimpft, genesen oder gestorben sein. Aber es ist tatsächlich ja so. Mit der sehr ansteckenden Delta-Variante ist das sehr, sehr wahrscheinlich.
The UK's infection rates are significantly below Austria's, 1,092 per 100,000 over the last 7 days, compared with 425 for every 100,000. But they are 4 times higher than Italy.
Something very strange would have to happen.
Okay, so I just wanted to show you this to give you an example of what's happening in the rest of the world. While we are lining up to get vaccinated in these developed countries, there are protests against vaccinations. How are we going to control this virus if people aren't agreed on what, on how this is transmitted and what kind of danger it poses to us? Okay, so message number 5, and I'll try to go through this a little faster. I promised not to take too long. We were handicapped from the start because of decades of neglect of the public health system in the Philippines. The early constraints, we only have 1 biosafety laboratory level 3, and that's why the testing was very slow. If you remember, the first few Chinese travelers who had COVID, we had to send our results to Japan and Australia because we could not verify them here. We did not have local PPE production, which resulted in deaths of health workers who were using and reusing their PPEs. And a big strategic mistake in the beginning was that we allowed all hospitals to accept COVID patients. And therefore, we had outbreaks in hospitals. Some of the big hospitals had to close down entire wards. So these were our early constraints. We knew that something was coming, but we were not prepared. And this is, as I said, it is because of decades of neglect of public health. It's not just because one decision was made. No, matagal na ito, hindi natin pinagplanuhan. I'd like to talk about the global proliferation of high containment laboratories because we obviously got left behind in terms of developing laboratories that could test for, manipulate, and actually track down viruses and their mutations. So right after 9/11, there was a big fear about bioterrorism. And so China built 30 level 3 laboratories. Taiwan built 20. Finland built 13, France had 12, Germany had 97, more than half of which were in Berlin. India had 6, Indonesia 2, Ireland 31, Singapore had 10, Russia had 84, Pakistan had 2, Mexico had 4, Malaysia had 3, Japan developed 200 biosafety level 3 laboratories, Italy had 4, Sweden 40, Switzerland 26, Thailand 23, the UK has 600, the USA had 1,643, and the Philippines had 1 and only 1 biosafety level laboratory, the Research Institute for Tropical Medicine. And when former Secretary Kwasi Romualdez was alive, he was the one who set up the Research Institute for Tropical Medicine. Early on, he was already saying we have to have more of these laboratories in different parts of the country. And actually, we had plans for vaccine production that were going to be done in Alabang with the late Remy Olvedo. It's not like we did not think that we have to prepare. Now, why is the biosafety level laboratory 3 important? It's important because you cannot set up biosafety level 2 laboratories, which have the RT-PCRs, right? Unless you have the mother laboratory, which is a biosafety level 3 laboratory. So right now, I think we only have 3 in the country. If I'm not mistaken, RITM, NIH, and possibly the Philippine General Hospital are level 3. But is that enough for 110 million population in an archipelago? Look at what the others have invested in. Look at how they have taken very seriously the threat of a pandemic. So in 2020, in March 16, we had 1 testing laboratories and all the hospitals accepted cases, and that was a disaster. By August, we had 110 testing laboratories. So this is to the credit of the NIH and RITM. Then 3 COVID referral hospitals, including the Philippine General Hospital, plus community isolation beds. And so we got a little bit more organized. But by March of 2021, we went under general community quarantine. There were more testing laboratories, multiple COVID hospitals, and yet we had full ICUs and full ERs. This was the start of Delta. So, okay. Again, as I said, our double whammy is continuing community transmission of the urban poor and returning overseas workers. And somehow, our officials can only focus on one or the other. Pag maraming umuwi na OFW, all our resources go there. Pag pumuputok sa isang urban slum area, lahat ng attention natin nandun. We have to do both. We have to be prepared to handle both of these because we are in a very unique situation. We are the only country in the world with 10 million overseas workers who may be coming from COVID-rich countries. So the other thing is we don't have electronic medical records. So right now, contact tracing is still a mess. Testing is done manually. I don't know where we would get a record and say, this person tested for COVID, got sick, got well, got vaccinated, got a booster. Wala. No? Parang ang gulo-gulo kasi we don't have electronic medical records. Message 6. If we do not invest in public health and social determinants of health, COVID-19 will become a chronic and lingering disease of the poor, like tuberculosis. And we're already seeing this. People who have the access, the money, are traveling to other countries to get the vaccinations that they want, to get the boosters whenever they want it. They have their own homes, they have their own doctors, they have their own nurses. So what do we need to do? Okay. We need to invest in a Philippine CDC. We do not have the surveillance capability that we need to be able to track every port, every island, every city, what's happening everywhere. We just haven't invested in it. And as I said, when Kwasi Romualdez was Secretary of Health, we already had a floor plan for this and the money. But as it happens in our country, when things changed and when leaders change, then all the good plans change. We need more laboratories, level 3 and 4, and we need more genome centers. Through the hard efforts of Chancellor Menchit Padilla and our colleagues in the Philippine Genome Center. At least we have one, but that's not enough for us. We need more genome centers all over the country. For treatment, okay, we need to seriously treat infectious diseases in every province and every city. And I'm not just talking about COVID. We're talking about tuberculosis, dengue, rabies, malaria, all of those infections that we have neglected. We have to be very serious about treating them. And this means specialty training for infectious disease for doctors and nurses. We need to do something about the environment. We have to decongest our cities. We have to implement family planning. There are too many Filipinos, too many babies being born. We heard this already in the webinar. How many are born to teenagers? 52 every week. I don't know. That's also a disaster in itself. And then water and sanitation. How can we say wash your hands when there's no water? We need to manufacture our own vaccines here, and we need to invest in vaccination programs. And we need a strong autonomous health promotion agency, a group like Public Health England that does nothing except tell people what their behavior should be or explain the mode of transmission of infectious diseases or non-communicable diseases. I won't go into this in detail, but surveillance in the country is so weak. We need to have the best kind of surveillance, and we do have very intelligent epidemiologists, but they need the support to be able to contain international movement of strains, contain spread within the country, prevent further spread in localities, quickly detect a cluster and contain the spread, remove the agent from infected hosts, and work on eradication when that time comes. Message 7, the full implementation of universal healthcare is the only solution to COVID-19. Can we control? Yes, but we need to change the system. Currently, if you see all this orange graph, all right, this is how much out-of-pocket spending Filipinos are doing. So it means that over time, since 1991, even with health insurance, the orange one is our out-of-pocket payment. We are still personally paying for all our health needs. So there needs to be serious reforms in health insurance. I won't go into detail. And for universal health coverage to be implemented, there are 33 provinces that are ready. If we implement universal health care, money goes to the governor, and the governors can use that money to implement good control programs. We continue to be in an emergency response mode. What we need is a COVID-19 control program with proper resources. What do we need? Right now, we can do this. We need a program that seeks to control COVID-19 by locality, guided by national protocols. There should be free, and I've said this many times, free testing. Maybe it's selective, maybe it's not everyone, but for essential workers and students, we have to allow testing to be accessible. Now, people don't like it because it's expensive. No, but if people know that they're positive, then they'll avoid transmission. No? So I go back to knowing the mode of transmission. We need a 6-year vaccination program, not just let's vaccinate everybody right now and that's the end. I'm telling you, that's not going to work. We're going to have to look at this as something like the vaccination for flu, where you have 1 or 2 shots every year. That means you need a program and infrastructure. And the very strong program for infrastructure was set in place by Secretary Alran Bengson right after the EDSA revolution. That was why Secretary Flavier was able to work on the eradication of polio, because there were midwives on the ground who were prepared, who had resources, who were trained to do vaccination program. We cannot be ad hoc about this. I understand now it's an emergency, and hats off to to the National Task Force for what they have done. But unless this becomes programmatic, continuing, we will not be able to go forward. We need to deploy electronic medical records. I can't understand why this can't be done. All of you use an ATM for banking. Why can we not have some kind of electronic record for our medical needs? We need short courses on COVID-19, on prevention, treatment, and management for all professionals at all levels, even if this is online. There has to be national and subnational COVID strategies, and then health financing for the treatment of COVID-19. People are still paying for their own treatment for COVID-19. Okay, so this is my last 2 slides. I took this picture in Baseco, Manila. When we were doing measles vaccination, I was working with the Red Cross at that time, and you know, these 2 kids, they break my heart. So I keep the picture because we talked to them about why it was important for them to get all their EPI, expanded program of immunization vaccines, and really this is for the next generation to survive. So finally, this is a marathon and not a sprint. Mahaba pa po ito. Self-care of our healthcare workers is the most important strategy for the control of COVID-19. So when you can, you conserve your energy, take care of yourselves and your loved ones. Okay, thank you very much.
Thank you very much, Doc Susie. Wow, nawindang ako sa presentation ni Doc Susie. Ang daming talagang pwedeng gawin, no, Doc Raymond? Ang dami natin pwedeng gawin to help stop COVID deaths and to control COVID.
Yes, from end to end, ang ginawa ni Pakner sa kanyang presentation. Thank you so much. Not every day that we get a comprehensive lecture from Dr. Susie. So we are really
masterclass talaga itong webinar na to, Doc Raymond. It's a masterclass by Doc Susie.
It would seem that inipon lahat ni Dr. Susie ang kanyang learnings for the past 2 years dito sa kanyang lecture. So we appreciate all of that, Dr. Susie. Okay, so let's go on and get the reactions from our other experts in the panel. Our first reactor is really surgeon extraordinaire, but also a dedicated teacher and researcher. Has been a public servant when he was the Secretary of the Department of Health during the Aquino administration. Please welcome again to your screens former Secretary of Health of the Republic of the Philippines, Dr. Ike Ona. Dr. Ona?
Good afternoon to everybody.
Good afternoon,
This
sir.
UP webinar topic today entitled Stop COVID Deaths, Will We Ever Control COVID-19? is both seemingly simplistic or very complicated, but most interesting and challenging, especially for us Filipinos here in the Philippines. As Dr. Susie Pineda has historically and succinctly discussed, it will take more than just pure science to defeat our infectious disease threat. It will entail a wider socioeconomic and political interplay in our society, both nationally and globally, for us to control this pandemic and other global health scourges that will definitely come to hound our health system. As a whole, the partial control today of this pandemic is the victory of pure science, but the global control will entail the need for a more equitable social, economic, and political distribution of wealth and knowledge, as well as supplies among our people to contain all these future scourges to come. A few days ago, President Duterte was reported to be aghast at the seemingly sudden significant reduction of Filipinos reported positive for the PCR test, as well as the reduction of those hospitalized or dying from COVID-19. As of today, these deaths that are reported, and in the morning paper, today there were, or yesterday there were 171 deaths and 370 infected or positive tests. These deaths are no more than our daily deaths from tuberculosis, pneumonia, or heart disease. Let me just give you an idea of the number of deaths last year, 2019, before COVID really became so extensive in our country. Our number one cause of death last year was ischemic heart disease, and they were reported of 97,500 deaths. That is 267 deaths per day. As I said, as of yesterday, there were 171 deaths reported from COVID. For number two, for example, there were 178 deaths from cancer per day last year. From stroke or CVA, there were 167 deaths per day. And of course, tuberculosis, there were 61 deaths per day. These are all reported deaths. And in pneumonia, this is pneumonia, very similar, of course, in terms of symptomatology to COVID. There were 172 deaths per day last year. Again, very similar to the number of deaths of COVID today. And so, where is the other side of pure science that is needed for us to preserve or mitigate another similar devastating catastrophe? And thus, this presentation of Dr. Susie Pineda, that is most informative, interesting, and challenging for all of us. The challenge, therefore, for us is how do we, as a people, respond to the demand of the times? And of course, how do our government respond to the challenges that Susie Pineda has presented this morning? Thank you. And before I end, let me greet all of you a very Merry Christmas, and please stay safe and healthy to this merry season. Thank you.
Thank you very much, Dr. Ike Ona. No? Parang yung sinabi nga ni Dr. Ona na how will we respond to the demands of the times and the challenges. No? Meron sa chat natin, nabasa ko, sabi, sana yung mga advocacy sa recommendations si Doc Susie mapanood ng mga tumatakbo for elections, no? Para maging part daw ng plataforma nila if they become part of the government. So thank you for that, Doc Ike, no? I also like what you said, it takes more than science. Pati nga sinasabi ni Doc Susie in our webinars, no? Lahat ng anong klaseng talino kailangan talaga ginagamit sa pagsugpo nitong COVID-19. And also, I really appreciate your mentioning the need for equity. Important po talaga yung equity. Okay, so we look forward to having you later on, no, Doc Ona, for our Q&A session.
I'll be here.
Thank you. So our next reactor is a consultant with the Guam Department of Public Health and Social Services and serves as the chair of the Guam State Epidemiological Outcomes Work Group. Please welcome to the webinar, Dr. Annette David. Hi, Dr. Annette.
Hi, thank you so much. Magandang hapon sa inyong lahat. Buenas yan, half a day from Guam, where 26% of our population are kababayans. Salamat sa classmate ko, si Dr. Susie Mercado, for inviting me to participate. I was very excited to see Dr. Susie introduce the epidemiologic triad as the mental model that we can use to understand this pandemic. Importante na may framework tayo. And to my view, that is a very important framework to use. So let's talk about it, agent, host, environment. Of course, agent yung virus, no? And I will challenge you to think about this pandemic from the perspective of the virus, di ba? Ang virus kasi, hindi yan completely alive. It needs a host to survive. Whether the host is animal or human, it needs a host to survive. So itong virus is going to be very keen on improving its efficiency in infecting the hosts. So it's not surprising for me that as new variants come on board, that maybe what will happen is they will become much more transmissible. Kasi yung virus is trying to find a way to increase its ability to infect as many hosts as possible para mabuhay siya as a species. And the other thing that the virus wants, of course, is not to kill the host. Kasi kung pinatay niya yung host, pati siya namatay. So a really efficient virus can infect a lot of people but keep them alive. So I'm hopeful that the Omicron variant will turn out to be a much less severe mutation of this virus. And these are really all evolutionary pressures that are working to create a more effective virus, which means it's important for us from the science perspective to address its ability to be highly transmissible. So yung vaccine is fundamental to the control, to the end game of this pandemic. So I'll ask, some of you are very young, you might not remember, but those of you who are my age or older, nanonood ba kayo ng Star Wars or Star Trek? Imagine that the Philippines is a spaceship that is under attack by COVID-19, diba? What happens when there's an attack on a spaceship? The first thing the captain will say is, shields up, diba? Shields up. The vaccine is the shield. And when your shield is 100%, your protection is at its greatest. But every unvaccinated person is a gap in that shield, which is why it is so important to be able to ensure that as many people in the community are completely and fully vaccinated and protected. Because ultimately, as new variants come out, they will be looking for those gaps in the shield to get to us, the community. And this is why it is so important to ensure that every person, as much as possible, gets the full protection from vaccination, which takes us to the second part of the triangle, the host. So if it's important to get as many people vaccinated as possible, then the issue of vaccine access becomes so critical for the host defenses. Kasi ano pa bang meron dyan to counter the virus? Back to basics, physical distancing, masking, hand hygiene, all of which are behaviors. And as you know, behaviors are not always reliable kasi not everyone is consistent. So the vaccine, which can reduce infectiousness, which can reduce severity of disease, and which can reduce death, becomes so critical. But access has to be assured. Kaya important dito yung health equity, right? For as long as there are pockets in our community, in our country, who have no access to the vaccine, this will continue to spread. For as long as there are countries in the world that have only 5% of their population vaccinated, it doesn't matter. If your country, if your island is 100% vaccinated, you will still get that virus circulating. So I think this perspective of the shield 100% is a way of ensuring that people realize that when they make the decision about getting the vaccine or not, it is not an individual choice, it is not an individual decision, but it really affects the outcome and the health of everyone inside the spaceship that is the Philippines, or the spaceship that is the world. And the other part to that equation is sometimes the vaccine is available, but people choose not to get it because they're anti-vaxxers, they're vaccine hesitant, hindi ba? Which takes us to the third part of the triangle, environment. And we talk about the social determinants of health, which affect health equity and vaccine access, but there's also the communications environment. And Dr. Susie mentioned this, it is so critical that we do not allow misinformation to win this war. Kasi if you think about it, misinformation is also a virus, di ba? It infects people and they can spread it very readily. So in that sense, we have to always consider that when we talk about the environment, we're not just talking about ventilation and the physical environment and the policy environment and the cultural environment, but we always consider the communications environment, especially with the advent of social media, which has now made access to misinformation so easy. And so I think I'll end by saying, for this pandemic, ang end game niyan, you need not just one vaccine, but you actually need 3 vaccines. You need a vaccine against the virus, you need a vaccine against health inequity, and you need a vaccine against misinformation. And that's from my end. Over to you again.
Thank you, Dr. Andy. Very well noted po ang inyong mga comments, and that's something that we really appreciate given that different nuances, especially for the Philippines as well in the United States. We really look forward to your insights additional po mamaya po sa ating Q&A session later on as we move on to our final reactor for this webinar. Our final reactor will be, should be coming in with a public health perspective, but with slight nuance po with regards to prioritization in terms of research. So please welcome to the webinar the College of Public Health's Associate Dean for Research with the University of Philippines, Manila, Dr. Vivien Fe Fadrilan-Camacho. Dr. Bing?
Yes, magandang hapon po sa lahat. Good afternoon to everyone. Doc Raymond, thank you for that kind introduction. I would like to thank, of course, the organizers for this invitation for this timely discussion on COVID-19. At this point, I would also like to thank our presenter, Dr. Susie Mercado. It's always a pleasure na parati ako na-excite pag nalalaman ko ang speaker ay si Doc Susie. Ayan, so I'm thankful for her comprehensive discussion. sharing her expertise and insights as we answer the question, no, yung topic natin, will we ever control COVID-19? I really appreciated no, how Doc Susie's talk was streamlined as key messages no, with historical background and also sharing of experiences for better understanding and impact. And I'm also honored to share this virtual floor as a reactor with Dr. Enrique Ona and of course Dr. Annette David. Ayan. So as the end of the year approaches, sabi nga no, we are nearing the second year anniversary of the pandemic. Globally, over 5 million have already died. And we all know that is actually an underestimate, especially there are still many countries that still lack resources to properly test and vaccinate populations. But in our country, we are seeing a decreasing trend. So may good news naman sa atin yan, decreasing trend of COVID-19 cases and deaths in the last few weeks. And also a 36% of our population is already fully vaccinated, while booster administration has started and our eligible pediatric population also starting to receive their vaccines. Our positivity rate is at 1.31%. Malaking improvement na po yan no? Compared to the last few months and syempre from last year. And with these promising numbers, the emergence of the Omicron variant poses another threat. So, ayan, kinakabahan na naman tayo. No? We don't know no, whether this will lead to another surge of cases or deaths or probably and we're hopeful, no? Sabi nga na kanina ni Dr. David, no, na sana hindi rin naman ganun kaseryoso. But we still do not know enough to tell. And good news no, is that the latest genome sequencing run of the Philippine Genome Center does not show any evidence that it has made its way into our country. Very quick lang, no, I would like to point out the discussions of Doc Susie, no, na talagang tumatak din sa akin, especially nga na mention na yung the principle of the epidemiologic triad with special mention of the socio-cultural determinants of health. No? She also clarified the concept of herd immunity. She shared tools for managing infections by having the relevant information and the role of risk communication, all of these leading to public health interventions for COVID-19 prevention and control. She also discussed how handicapped our health system is. No, naramdaman natin to particularly at the start of the pandemic and atong latter part of 2020 with the surge of cases and also this year in 2021. She gave recommendations based on the social-cultural determinants of health to guide investments for COVID-19 control. She also emphasized the need to ensure that our healthcare workers' health and welfare are protected. So binanggit niya yung self-care, very important talagang role ng ating mga healthcare workers because they are the frontliners. She also reiterated the importance of our universal healthcare to reduce the burden of the disease by addressing issues, of course, on social protection and health equity. All of us are already ready no, for the pandemic to be over. Gusto na natin bumalik sana sa normal, but it is still unclear what that would look like. No? The highly transmissible nature of the COVID-19 variants, ongoing vaccine hesitancy and incomplete protection against transmission by current public health measures mean that a goal of zero COVID-19 is very unlikely at this point. No? It looks like we need to learn to live with COVID-19, at least over the medium term. Since eradication of the virus is still unlikely, the goal is to at least control it to reduce morbidity and mortality in the community. With the current promising COVID-19 statistics in our country and some parts of the world, it seems like some form of control is definitely possible. Pandemics and epidemics usually end in several ways. Either we close off all chains of transmission, taking note again of the epidemiologic triad, and drive cases to zero, as with all the Ebola epidemics to date, or the disease becomes an ongoing part of the infectious disease landscape or becoming an endemic, as tuberculosis. Occasionally, as with smallpox, no, nabanggit kanina, na-eradicate naman siya. But for the most part, endemic diseases are here to stay and at least controlled. Societies, our communities will have to adapt, no, to living alongside COVID-19 by making some deliberate choices about how to coexist. This global pandemic once again highlights the importance of research, stable research infrastructure, and funding for public health emergency disaster preparedness, response, and resiliency. So the stakes are definitely high, no, in terms of worldwide pandemic, no, wherein many lives have been lost. Economic losses and lives have radically changed. We saw that ultimate mitigation and crisis resolution is dependent on high quality research aligned with top priority community goals that yields trustworthy data and actionable information. Meanwhile, the highest priority goals are treatment and prevention. Biomedical research also provides data critical to manage and restore economic and social welfare. The number of studies related to COVID-19 has definitely increased, and the scope and magnitude of the engagement, no, and the extent of global collaboration are remarkable. Researchers have led to the development of diagnostic tools, drugs, vaccines, and other public health interventions that have helped control COVID-19. University of the Philippines, particularly UP Manila, continue its mandate to conduct researches to contribute to the pool of COVID-19 knowledge in coordination, of course, with our partners such as the Department of Health, DOST, and other relevant local and international agencies. Na-mention na po kanina yung vaccines, no? So as we all know, vaccines have significantly helped in curbing the COVID-19 cases and deaths. But there is this issue of waning immunity over time. So there are still, and also there are still many left unvaccinated, including our children, which highlights the need for continuous research for effective and more sustainable interventions. Relevant researches on new normal setups in schools and work are helpful in providing insights on how to navigate, no, these new arrangements, ensuring health, safety, and productivity. Our situation makes it unlikely at this point for us to eliminate the virus. So the short-term goal is control by reduction of incidence on acceptable level due to deliberate efforts. Although this will come at a cost where we will still have COVID-19 deaths and additional chronic outcomes, no, such as long COVID. Luckily, the combination of vaccination, infection-induced immunity, and novel treatments should reduce the risk of serious infections and death from COVID-19 over time. Annual vaccination may be necessary, nabanggit nga, no, mukhang kailangan ng continuous vaccination to keep immunity high and to respond to any variations in circulating virus. Minimum public health standards such as wearing of masks, regular washing of hands, good ventilation, indoor scuff etiquette are now part of our new normal. For now, it seems like COVID-19 will likely always be here, but with scientific-driven interventions, it can be controlled. This highlights the need for interventions enabled by a reformed health system driven by science and consideration of socio-cultural determinants of health, leading to evidence-based policies, programs, and services, utilizing a whole society and systems approach involving all sectors and the whole community to collectively work to fight against the virus. With that, maraming salamat po at magandang hapon po.
Okay, thank you very much, Doc Bing. Please stay on for the Q&A session later on. Yeah, so
Yes,
at this point, Doc Raymond, let's ask everyone to join us, no, in the panel. Can we ask Doc Susie, Doc Andy David, Doc Ike Ona, and Doc Bing Fadrilan-Camacho to please join us on the panel. And as they're switching on their videos, let us take a quick break for a special public service announcement today.
Bayad po.
Salamat po.
Mama, bayad po.
Naku, anak. Tabi mo na yan. Para masuklian ko ang mga sakripisyo niya sa taong bayan.
Mapagbigay po kayo. Nakikita kong mahal na mahal ninyo ang inyong pamilya.
Tama ka. Kaya nag-aalala ako. Paano ba matapos tong pandemyang to?
Para matapos, umpisahan na ninyo. Magpabakuna na kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Okay. Very very nice commercial or public service announcement from the team. The public service announcement po is what we call our COVID communication PSA. It's one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by our UP Vice President for Public Affairs, Dr. Nenny Pernia, and funded by the DOST Philippine Council for Health Research and Development and the Department of Health through its AHEAD HSPR project. So we are privileged to have the project leader also to join us for our panel. So Dr. Nenny Pernia will be coming in also and giving, from a communications perspective with regards to the topic at hand. AVP Rica?
Yes, the PSAs are continuing commitment to push for COVID-19 vaccination for everyone who is eligible. So unless an overwhelming majority of our people are vaccinated, this virus will keep on mutating. So please get vaccinated as an act of love for yourself, for your family, and your community, and your countrymen, and so that our health systems will not be overwhelmed.
Vaccination remains one of the control tools in our arsenal to fight the pandemic, along with the standard public health protocols such as wearing of the face mask, frequent hand washing, physical distancing, avoiding crowded places, and proper ventilation.
Yes, and also, we understand that everybody's so busy, so we have some selected presentations that we will feature in its entirety in what we lovingly call the Stop COVID Death Shorts. So you can watch them at your convenience at the TVUP YouTube channel. So ito po yung mga presentations lang, no, ng ating mga speakers. TVUP, do we have a graphic for our SCD Shorts playlist? Yan, you can watch them at sa TVUP channel. Yan, ang cute niya, no? Bakit siya shorts, Doc Raymond?
It's just a very very short clip of an entirety of the video po. So maraming salamat for that and for giving us just a laugh in terms of how we'd be able to better appreciate ang ating mga webinars and our outputs po sa ating TVUP channel. Okay, to start the ball rolling, since we don't have much time, I'd like to ask the very first question before we call on our live audience who will be asking the questions po, no? So Dr. Susie, in her presentation, as well as our reactions that we have heard from Secretary Ona, from Dr. Andy, and from Dr. Bing, laid out po yung mga recommendations on how to go about with regards to dealing with the pandemic. I have two questions, and this is mostly an aggregation of what we have called from outside the Zoom and in the Zoom. Number one would be, what is the take of the group with regards to vaccine mandates? We all know that the WHO has already released a statement that as a last resort, vaccine mandates po ang gagawin. But what's the opinion of the group with regards to that? And then number two, it will have to do po with so we talk about the silver lining, the good things that we could look forward to once the pandemic is done and over with. But just to put it in balance, so to speak, what will be, let's say, have we seen the worst of the pandemic, or is there something else that's worse than where we are right now that we have not seen? And something, not to be a doomsday seeker, but something that we might need to put in our consciousness as part of it. I'll pose it to Dr. Susie as our main presenter.
Okay, so vaccine mandates. All right. You know that the difficulty with vaccine mandates is it's like a shortcut for for what should be really a very purposive communication campaign. I don't think that we cannot explain to people why it is important. Now, I think we have not done enough to explain it in a way that people can understand. And therefore, the shortcut is pilitin natin lahat ng tao. Okay? Now, the problem with yung pilitan is that the reaction becomes political. It's about, why are you forcing me to do this? Instead of, how do we get people to understand they need to do this? So for example, when Secretary Flavier worked on the eradication of polio in the 1990s, there was no mandate. Hindi sinabing kailangan bakunahan kayong lahat. No, but there was a campaign. There was a campaign. He went around the country. He talked to the mayors, the midwives, media, etc. And people brought their kids for vaccination. There was no mandate. So I think I would use mandate as a last resort. What I haven't seen is a very clear, powerful campaign on why people need to be vaccinated. There's bits and pieces of it, but not the kind that and at that time, we mobilized 9 million children for vaccination, even in the most rural areas, no? But it took time, and it was really a campaign, like an election, almost like that. What was your second question, Raymond?
Something about have we seen the worst of the pandemic,
Okay.
Dr. Susie?
Oh dear. I have no crystal ball. I don't know. I don't know.
Can I just ask Doc Susie? No, we have VP Nanny here. It's Dr. Elena E. Pernia. We talked about communication, about we need a campaign. So VP Nanny, can you help us out on this? What are your thoughts?
There is no mandate for good communication. Good communication is what is necessary. What Dr. Flavier did was phenomenal when it comes to communicating science. It was really bringing down the science to a level that was understandable by target audiences. And I reiterate what Susie just said. There was no mandate for vaccination, as is there is no mandate for good communication. It is incumbent, upon department secretaries, to be able to speak with, to communicate. Communication is not a one-way transfer. Communication is, we all understand this, it is a recurring process. It is reiterative. It is continuous. It doesn't end, diba? And that's what's important. It's also something that should be not scary, and that is often what happens when we talk about health. Because a lot of our health communication is fear communication, and that should change. That maybe that's why people are hesitant regarding vaccinations in the first place. But
we're very fortunate to have a former Secretary of Health with
That's our
us.
segue to Dr. Ike, VP Neni. So Dr. Ike, just to just to frame also your response, how would you say the major difference, I would guess, during the 90s and up to now, and what would be your advice to the current team with regards to pushing forward with vaccination, sir?
Yeah, and I think you hit it right. Ang difference kasi is when we are talking of polio or maybe even smallpox, alam na natin masyado yung sakit na yun. And it's been there for several years. Now, when COVID-19 came along, it went just like a super typhoon for the whole world practically. And that's the reason why I kind of disagree with Susie on this, that I really think that the mandate should be very strong now. I think there has been more than enough information. And I think it's very clear to me that when you mandate somebody to have to be immunized, it's really a protection not only of himself but for the whole public, his family and everything, and every person that he meets. And since this was an acute situation and really a raging so-called pandemic, and with not enough information right away at the initial, maybe at the initial first year of it. But today, where we are now on our second year, and we would like to make sure that no resurgence of this comes along, I think a well-planned so-called mandate wherein public will be given a certain incentive, full information, which I think the public is already getting from so many sources, especially with a more global information that's coming into to the whole world and to the country, especially the Philippines. I think there is already time for us to mandate it without necessarily giving so-called severe or significant so-called in quotation mark punishment for those who would not like to be vaccinated.
May I ask Dr. Annette David, because you're based in Guam, are there vaccine mandates in Guam?
Yes, we do. Our governor is a nurse. She's an ICU nurse, and she's very courageous. And at the point where, where our vaccination rates were going down, she pushed for the mandates and stood firm to all of the people who stood against her. Today, we have, of the eligible population in Guam, 89% are vaccinated, and of the total population, 82%. And that really made the difference in our numbers. But having said that, I think we also need to talk about what is at the heart of this issue, right? Because it's an issue of trust at the heart of it, diba? If communities trust their leaders, if they trust the healthcare system, if they trust the political leaders, then the communication is well received and people will act accordingly. When there is a lack of trust, then that becomes an uphill battle.
Yeah. Can we hear from Doc Fadrilan, Doc Bing?
Yes, opo. Thank you very much for that question. Ano po, para sa akin naman po, regarding mandates, I agree with Doc Susie. Para sa akin, last resort siya. Ako rin po kasi I haven't feel that we have exhausted all the possible ways on how to communicate properly with our target population. Yun po yung sa akin. But I would like to raise another concern, with this, aside from the mandate kasi, especially aside with the communication, proper communication to the population, to the public, it's very important to have an enabling environment as well. Because we keep on saying na magpabakuna tayo, wala naman pong bakunang available, particularly in the far-flung area. So I think we should have an enabling environment as well so that we can properly implement our vaccination programs. Thank you.
Thank you. Doc Raymond, I think we have some questions from our audience.
Yes, we have one from Sir Camilo Nogoy. He has several questions po, but I'll let him ask the questions that he prefers. And please address your questions to any of our expert panelists. Sir Camilo, go ahead.
Hi, good afternoon to everyone. Most of the things I heard are coming from authorities, what they should do regarding public health. But what's the role of the citizens? Because it is public health. And if we go to the news here in the Philippines, it's always news. It's always one way what the government should do. But how about exacting responsibilities from the citizens regarding public health? And the additional question is Doc Susie willing to be the DOH secretary? Thank you.
Hindi ko masyadong narinig yung last question na.
Dr. Susie, go ahead. The citizens' role in terms of public health.
Okay. I think I'm a health promotion person. So for me, citizens are the solution. For me, I think we have 110 million solutions to this problem. If everybody was careful doing what they need to do, we would have less transmission. Now, having said that, as I mentioned in the epidemiologic triad, what do you do when 10 of you live in the house and suddenly one person develops COVID? So there is a balance here between what the responsibility of the citizen is and how the government is able to provide for our needs. And I do believe that over the years, so I'm not talking about one president or whatever, over the years, we have really neglected public health, including the most basic things that people need: housing, water, decent jobs. So for me, I think for those of us who can afford to take all the precautions, it is your responsibility to be careful. But we have to bear in mind that for many people, they don't have that choice. Diba? Sabihin natin, stay healthy, eat healthy. Wala nga silang makain. So there are two, what should I say, two parts of this. But I do believe that everyone with a little information can do better in terms of health. So I'm gonna just add a little example. In the time of Secretary Flavier, we were severely criticized for coming up with a campaign on preventive cardiology, on preventing heart disease. And the criticism came from the public health experts of the country who said, why are you going to have that program when the government cannot buy medicine for everybody? And Secretary Flavier was very firm. He said, if I know I have hypertension, I'll eat less chicharon, right? I won't eat bagoong with my kare-kare. He could explain very clearly what the role of the citizen was. So not everything is the responsibility of the government, but having information in the hands of the citizens. I never underestimate the ability of Filipinos na gumawa ng paraan na magkaroon ng abilidad para ayusin yung problema.
Wow, thank you very much, Doc Susie. I think we're getting close to the top of the hour. Doc Rayma, maybe we should show our panel na the answers of our audience sa Zoom Mentimeter.
Okay. Can we have the fun quiz be shown and the questions on Menti so that we could ask our experts to answer the question. So there we go. Okay. So medyo marami po ang sumagot ng ating mga katanungan. I'm not sure if you are able to. There we go, ang ating Menti. The two questions are as follows. Question number 1, which of the following diseases have been eradicated in the world? Ang majority po, 55% in Zoom and 59% in Menti chose smallpox. So ano po ba ang tamang katanungan po dito, Dr. Susie?
So the only disease that has been globally eradicated is smallpox. As mentioned, polio has been eradicated in all continents except Asia. So it is only smallpox. So I think medyo nananaginip tayo that we're going to eradicate COVID-19 soon. Okay. So I just wanted to put this in. It takes a lot of time to eradicate a disease or to remove the agent, yung sinasabi nating agent.
Ayun. Thank you so much. And question number 2, which of the following infections contributed to the highest mortality across ages last year, which is the year 2020? 75% in Zoom and 77% in Menti chose COVID-19. So ano po ba ang tamang kasagutan?
Okay, so the leading infectious disease, the leading infection that causes death in the country is pneumonia. And through all ages, through so many years, among the infections, it's pneumonia. And we have treatment for this, there's medication, there's diagnostics, and yet people still die of pneumonia. It's because they don't have access to healthcare. So the answer to that is pneumonia.
Okay.
Wow.
Thank you so much, Dr. Susie. Maraming salamat din po sa more than, I think, 755 na sumagot sa Zoom and then another 95 na sumagot po sa Menti. ng ating fun quiz. Hopefully that's something that you were able to learn not just in the but also sa ating fun quiz for today. We will be asking each and every one of our speakers their parting words, essentially their final messages po sa ating audience, and hopefully that's something that they will be able to carry on through the next year, through the next few weeks up to next year po, and something that we could really look forward in the next few months. While they are medyo nagmumuni-muni, we are going to post our evaluation poll. We are seeing 100, almost 200 or past 200 na po attendees responding to our evaluation poll. As mentioned po in previous webinars, wala po kaming nilalabas na separate na evaluation poll. Ito na po yun. So we hope that our 770 plus attendees are able to input their answers. The questions are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Medyo nagkakaproblema po kami sa aming evaluation poll po ulit. We will be relaunching it and will not be closing it anytime soon as we move on to our final messages.
Sorry, Doc Raymond. When we launch the poll, pwede ho wag pindutin yung red button in the lower right-hand corner. You can press the X circle sa upper left-hand corner.
Upper left,
remove
yes.
it on your screen.
Thank you, AVP Rica. No, it's okay kasi medyo, I think there's really, bumalik yung ating problema with the evaluation poll. But anyway, we'd like to ask our speakers na po, and we'll do it in reverse chronological order for their final messages. We'll start off with the Associate Dean for Research of the College of Public Health, Dr. Vivien Camacho. Dr. Bing, your final message to our audience.
Thank you very much, Dr. Raymond. Thank you very much to everyone for listening and attending this last webinar for this year. So as for my parting words, the horizon is not as gloomy as before, but many things are still uncertain. The important thing is that we continue to work together, making use of a whole society approach, empowering everyone, especially the community, learning from history and experiences, and making use of evidence-based public health interventions to help us thrive against COVID-19. And with that, thank you very much for this opportunity. Let us all have a blessed, healthy, and safe holidays. Maraming salamat po sa lahat.
Okay, thank you so much, Dr. Bing. Before we go on to Dr. Andy, we'd like to ask our communications expert, VP Neni, for her final message to our audience.
Yes, good afternoon. When Susie was presenting a little while ago about that triangle, about who has responsibility for what, it reminded me of Ambition 2040. Ambition 2040 is the collective vision and aspirations of the Filipino people. And in that vision, one of the things that we want as a people is to have a good quality of life, which includes a good quality, stable, comfortable lifestyle, which includes quality health care. And when somebody asks, what should the citizen do? It's always government, what government should do, what government should. Well, citizens vote in their government. So it's both. If we want, if we want government to be empowered to do what it is that leads to our own good, then we should also be thinking about, putting in people in positions of leadership who are true leaders, and among that is having the heart and soul of our country, as well as being good exemplars. And so, a good communication is incumbent upon good leadership.
Thank you so much, VP Neni. We move on to our expert also coming in from Guam, Dr. Andy David.
Remember that we need not one vaccine, but 3 vaccines. One to counter COVID, one to counter health inequity, and one to counter misinformation. So hang in there, stay the course, and help each other to make the right healthy choice.
Yun, galing. Very short and sweet, but we really appreciate it, Dr. Andy. Thank you so much. Sir Ike, Dr. Ona, your parting words po to our audience.
Well, my parting message is essentially that pure science will give us all the necessary information on how we can possibly control it. But it's the socioeconomic limitation of the society, both in our country as well as globally, that will be needed to eventually make sure that we live a healthy life and comfortable life for everybody.
Thank you, Secretary Ona. And finally, we have our main presenter, my partner, Dr. Susie Pineda Mercado. Your final words, Dr. Susie.
Yeah, conserve your energy. So I know many of our audience are frontliners, doctors, nurses all over. You have to conserve your energy kasi mahaba pa to eh. No, parang when I was preparing for this, I thought, geez, this is so difficult to talk about an end game, but we joined this profession knowing that there will be sacrifices that we have to make when an emergency like this happens. And you have all shown your ability to sacrifice, to serve, and to do your best for other people. So conserve your energy so that you don't burn out. Look for opportunities to take little breaks and to take care of yourself. Because, as I said, this is a marathon and it's not a sprint. We have to brace ourselves for new things that will come. And I agree with Sec Ike, no? There will be new drugs. There will be faster tests. There will be more efficient vaccines. But if in our society, there's such a big difference between the rich and the poor, yung mga mahihirap talaga ang mag-aano dito ay na magkakaroon ng magiging dehado. So I know that all of you are working very hard. And this Christmas season, I hope that you'll find some time to, as I said, recover, revitalize, and conserve your energy. Because what we need to do, like in a war, is we need to survive. We need to survive this epidemic na hindi tayo masungit, hindi tayo agitated, hindi tayo nagwawala. Diba? We need to keep our families intact. We have to take care of our teenagers who are so stressed out. So conserve your energy, take care of yourself, and this Christmas season, spend some time in silence and thank our Lord that we are here and that we're making it. And because we're alive and we are able to serve, that is the way that we return our thanks. We continue to serve and sacrifice. Thanks, everyone.
Thank you very much, Doc Susil. Medyo nag-emotional ako doon. Thank you very much sa inyong lahat, to our panel. I think, Doc Raymond, let's show our appreciation to our panel, no, by showing them the panel evaluation poll results from our audience.
Okay, can we have that on the screen at the very least, yung the last one? Okay, so as it's very similar to our previous webinars, very high marks, at least 95% across the board sa ating evaluation. So maraming salamat din po, pati na rin po sa mga nag-input sa chat ng kanilang mga evaluations. We really appreciate all of this, and that's something that we collect and try to put forward in terms of being able to improve our future webinars po. Over to you, EVP Rica, for the introduction of our closing remarks.
Yes, to formally close this webinar, let us now hear a brief synthesis and closing remarks from the Deputy Director for Health Operations at the Philippine General Hospital. Please welcome Dr. Stella Marie L. Jose.
Good afternoon, everyone. This has been a very enlightening webinar. Talagang we ended our year with the bomb, no? Talagang exploding information from Dr. Susie Pineda She explained the epidemiologic triad of the agent, the host, and the environment. So the agent here is the SARS-CoV-2, and the host. What is important with the host is the nutrition, if she has comorbidities, and the status of the immune system. And in the environment, our environment, the crowded environment, the OFWs, and the congested cities. So for the agent, what we need is the vaccine. So paulit-ulit in our webinar that we should all be vaccinated. We owe it to ourselves and we owe it to our country. And as mentioned, for the host, we should all be wearing masks. We should be tested and all these things that we should do for our environment. Yun nga, dapat there should be safe transport, isolation, safe working place, and decongest the cities and the slums. Okay, another message of Susie was the herd immunity, no? Paulit-ulit din yan sinasabi in our webinar. Madaming speakers ko na yan narinig about herd immunity. But as the public, from the public health point of view, herd immunity occurs after decades of routine immunization. As long as there is community transmission, reinfection is possible. So, ang message ni Susie, so what can we do now? Health programs that seek to control COVID-19 locally, guided by national protocols. Yun ang kailangan natin. We should have free or selected testing initially for essential workers and students. Because right now, it is not free and people spend for testing. We should have a 6-year vaccination program and infection control. And we should deploy electronic medical records for contact tracing. So that's important. No? Here in PGH, we already have electronic medical records, but in other places, that is very lacking. And we should have short courses on COVID-19 prevention and the national and subnational COVID-19 programs. So also health financing for the treatment of COVID. From Dr. Ike Ona, he mentioned that it is more than science, and it is really the socio-economic environment which is important. His challenge to us is how will we respond to this time? So, ibig sabihin, how will we as medical practitioners or healthcare workers? And to him, there should be a strong mandate to immunize. Okay? From Dr. Annette David, Annette also bolstered the presentation of Susie as a public health official. She mentioned that vaccines is very essential to control this pandemic. Kinompare niya pa sa Star Wars. Sabi niya, pag nakavaccinate daw tayo, shields up tayo. And every unvaccinated person, there is a gap in the shield. So, tandaan natin yon when we, as doctors, nurses, when we explain to our patient. That's a good analogy. The vaccine, tayo ma-vaccinate. And health equity is most important. And as mentioned nga, yung vaccine ang ating shield. So the environment, we should not allow misinformation to win in this war. Alam nyo, ang bilis-bilis kumalat ng misinformation. Makakita ka ng Viber message ngayon, in all your other Viber groups, lalabas na yan, that misinformation. So the vaccines, we should have vaccines against the virus. We should have vaccines against health inequity and vaccines against misinformation. And as mentioned by Annette, the basic issue here is trust. So important, we should trust our government, our healthcare system, our doctors. From Dr. Vivien Camacho, she mentioned that yun nga, ang good news dun sa Philippine Genome Center that Omicron has not yet entered our society, our country. So baka sana tuloy-tuloy na yan, hindi mag-enter. And also, she mentioned the importance of the social, cultural, economic, which are factors which are the determinants of health. Ang sabi niya, zero goal is unlikely, and there should and there should be some degree of control may be possible, okay, with vaccination. Vaccines, yun nga, nagkakaroon ng waning immunity over time. So baka later on, magiging every year na ang vaccination like flu vaccine. And yung short-term control is the reduction of transmission, and it is science-driven. And as being mentioned, we should involve all sectors. Okay, so it's hard to make a summary of all your presentations. They're all good. And I congratulate all the speakers, Dr. Susie, Annette, Sir Ike, and Dean. Thank you for your attention.
Thank you very much, Doc Stella. Ang galing-galing talaga ni Doc Stella synthesize. I don't know how you do it. Parang ako minsan nga, I try on my own to take down notes, pero talagang very comprehensive si Doc Stella. So thank you po. And maybe ask Doc Susie to please join us as we say goodbye to our viewers for our Christmas break. No? And we hope to see everyone back again next year for our regular Friday lunch date. Doc Susie?
Yeah, so everyone, I hope you have a Merry Christmas and take care. Yung pag-iingat, gawin na nating part ng buhay natin, especially for this holiday season.
Okay, Doc Raymond?
Yes, thank you so much, EVP Rica, and thank you, Dr. Susie. Something that we normally will tend to forget just because of the our partying, the holiday cheer, the holiday spirit, etc. But very, very important to remember still na we still have the COVID-19 pandemic at hand. We would still need to adhere to the minimum public health standards, and for those who are still unvaccinated, magpabakuna na po kayo. And we look forward to be able to see you again, all of you na nandito po sa ating webinar, ating mga avid viewers when we are back again in January 2022. But before we conclude our program for today, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, hindi po talaga magagampanan natin ang hard work na ito and the ability to be able to churn out quality content week in and week out. So at least magkakaroon po tayo ng very, very brief break. Makita-kita po rin po tayo next year when we try to come up with quality topics and our roster of speakers for the future webinars. Finally, we have our archiving of all of the Stop COVID Deaths webinars po from webinar number 1 to webinar number 81 at least, and after this webinar, webinar number 82 will be archived also in the YouTube channel of TVUP. Maraming salamat po sa inyong lahat, lalo na po sa mga gusto pong ulitin ang pagpapanood sa playback or yung meron pong nakaligtaan, nakalimutan, hindi po nakanood. You'll be able to watch each of those webinars in the TVUP YouTube channel. So this formally closes our webinar for the year. Makikita-kita po tayo ulit next year po, no? And we look forward to seeing each and every one of you same time from Friday 12 noon to 2 p.m. From 12 noon to 2 p.m. It's a date.
Together we can stop COVID deaths.
Stay safe,
stay healthy,
and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. this time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others vows before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold